Squats are used in a lot of resistance training and dry land programs ranging from swimming to water polo to diving. Unfortunately, a lot of people do the squat biomechanics incorrectly or have difficulties applying what the exact form is from a swimming turn, for example, to an actual squat. One of the main things we want to be remembering with the squat is we want to decrease the amount of stress at the knees and the amount of injury risk that you're having with the squat. We also want to decrease the amount of spinal pressure or stress that you're having. Something that I see a lot of athletes trying to go, all the way down to the floor, and they're going to put a little bit too much stress on their low back. Okay, how deep an athlete can go depends on a lot of factors, but one of the biggest ones is just the hip architecture. Okay, if you have your acetabulum, which is part of your pelvis here, it's kind of your hip socket joint in your hip here. If you have a deep acetabulum, when you're squatting down or that knee's coming or that hip's coming forward on the femur, what that's going to do is tilt your pelvis back. Okay, if you have a more shallow acetabulum, you're more likely to slide and glide in that hip socket without having that extra sacral tilt or that extra little tilt in that low back. Okay, having a deep acetabulum is also theorized to be one of the reasons why people aren't too good at breaststroke. Okay, they can't move their hip to the side, or they may have problems with egg beater kip compared to those athletes that are natural breaststrokers or natural egg beaters that have a more shallow hip socket. They can just rotate their hip right in that acetabulum, moving that femur all the way around. Okay, so first and foremost, when you're working on your squat, I always suggest for an athlete to work on just a wall squat to begin with, okay, or just a squat hold. So they're just squatting down, holding, work on hip, knee, ankle in a straight line, okay? On that, you don't want to go down too far. Like I said, you can go against a wall, just doing a wall squat, really making sure their knees aren't coming together. If you think about our knees as the center of a twig, if you bend the hips and bend the ankle one way, that middle portion is going to break. That's the twig, that's where that pressure is going to be on the knee. Okay, then when you're actually going to get into an actual squat, okay, you have your athletes put their hand on their hips. Okay, I always say put your fingers on the pelvis in the front, the ASIS. That back of the hand is just going to be kind of right where those little divots are for your thumbs, okay, and your low back. Okay, that's a PSIS. That's really your pelvis. That's how you can tell if your sacrum is moving or you're getting too much flexion there. Then what the athlete's going to be doing, they have their hands on their front and back. They're squatting back, once again, not letting their knees cave in, squatting back and coming down, feeling for when their hands tilt back like a bucket. Okay, we don't want that bucket to fall back. If we think about it, if we're falling back here, our back's rounding, that's when we're going to have that that stress on our low back, put some extra stress on our low back disc. Okay, so once again, when we're doing this, I'll give you two views here. So here, squatting down, hips coming back, really pulling the knees out, feeling that tension in the hips, hands on the hips so we're not letting our pelvis tilt back, and then returning back up. Okay, we should feel the tension in the sides of the legs. Once again, we're here, hands in the front and back, sitting back, pulling those knees out, feeling that tension, and then returning back up. A lot of people will talk about foot position here during the squats. I really think that whatever is comfortable for that athlete is going to be ideal, especially if we start working with breaststrokers, egg beater kickers who may have more femoral retroversion, or their hip is rotated back a little bit more. If we're moving them in this position, that may put them at a little more vulnerable position, putting that risk for impingement. Okay, for swimming specifically, a lot of people think that the squat is going to translate directly into the turn, but on a turn it's way different. Athletes land on their toes and they press up, so that's more of like almost like your jumping rope sort of motion. So you just have to keep that in mind and realize, okay, maybe the specificity of this movement isn't perfect. However, if you think an athlete can benefit from some stronger hips, or you want to help give them just some general preparation for their athlete, some general strength, also help develop some gluteal muscles that are very weak in many swimmers and even water polo athletes, the squat could be a great exercise for you if done correctly, but keeping the hip, knee, ankle in a straight line, not putting extra stress on the knee, and then also not bending that pelvis, getting too much sacral flexion and low back stress. This is our core vid.